About 30 years ago, I was working in practice doing exactly what everybody else is doing and wanted to find something a little bit more exciting, interesting to do than just drill and fill. Nothing wrong with doing that, I enjoy it. But at the same time, I was seeing people who come in with headaches, neck pain, back pain, ringing in the ears, deafness, and so on. And I'd say, what's your doctor doing about this? And they'd say, oh, you know, this, that, I'm taking this drug or that drug. And back then, 30 years ago, a lot of people were taking Valium because then it wasn't addictive. Now, maybe it is. And so I looked at the whole area of head, neck and back pain. At that time, of course, it was called TMJ. As Harold Gelb used to say, he's from New York, and he'd say, oh, it's the great imposter. In other words, it's got all these symptoms that we think of as TMJ, but TMJ is just the jaw joint, and TMJ dysfunction is dysfunction of the jaw joint. And that's okay, and you can treat that, but it's moving beyond that and looking at how what goes on in the mouth affects the rest of the body. So not just looking at the joint, but you look at the teeth, the way the teeth come together, the way the jaw joint works, how it relates to the cervical spine, how the cervical spine relates to the rest of the spine, and how the body actually functions. So then you look at the symptoms of TMJ, headaches, neck pain, back pain, muscle pain, and you say, okay, fine, so what's really going on? How can I change what's going on? You know, what difference can I make? So you look at the individual and say, okay, fine, this is what I'm seeing, this is what you come in with, and it may be a broken tooth. It may be teeth that the patient's had teeth extracted. It may be that they've got missing teeth. Any of those things, it may be that the bite is very deep and just doesn't work very well. They may have crowded teeth. But all of those things are signposts. They just say, okay, fine, so what am I seeing and how can I relate that to the rest of the body? It was Gouze who said, he was a physicist, and they asked him to look at the relationship between the jaw joint and the cervical spine. And Gouze said the relationship is the pivotal point of rotation of the jaw joint is between C1 and C2. So if that's the case, then if the bite doesn't function properly, the jaw joint doesn't function properly, and then you have problems in the cervical spine. And so often people come in and say, oh, I've got this really bad neck pain, or they're referred by a chiropractor, osteopath, physiotherapist, and I work with them all as best I can. We do a lot of work together. And I say, okay, fine, so my job is to balance this lot up, make sure this works, make sure the jaw's in the right position, bottom jaw to upper jaw, and then work with them to actually get everything else going and get the patient to function the best they possibly can. So that's my take, if you like, on TMJ. It's not just the jaw joint, although, as I said, when if you look at a classic jaw joint problem, clicking of the jaw, cracking, popping, a locking of the jaw joint, waking up in the morning with the jaw locked, then you need to address those issues. But quite often, it's that relationship of the teeth. Is every patient a grinder or a clencher? No, they're not. Does everybody have limited opening of the mouth? No, some open perfectly well, but still have all those symptoms that need to be treated.